I'm showing students how to do a capillary puncture. And since Dr. Richards knew that you were coming in to have the procedure done, we thought you'd volunteer.
No, that's okay. I'm glad to help.
For a small sample, we don't use a needle, but an automatic lancet. It's spring-loaded and regulates the depth of the puncture. In the old days, they used manual lancets, but OSHA guidelines now forbid them. Since Mrs. Burns is an adult, the best puncture sites are the tips of the ring or middle fingers of the non-dominant hand. Avoid the index finger because the skin is thicker there.
If you're working with an infant, the puncture sites are different. An infant's fingers are not large enough to puncture without hitting bone. The best site is the bottom of the heel of the foot. If the child is older than a year or already walking, then you use a thumb.
When you're ready to perform the test, you need to wash your hands, put on gloves, and wipe the patient's finger with an alcohol pad. Once the alcohol evaporates, squeeze the finger 1 inch below the puncture site. Puncture the side of the patient's finger because the center is generally tougher. Immediately discard the lancet in the sharps container. Then, wipe away the first drop of blood with a gauze pad because it may contain alcohol or other contaminants that can prevent an accurate test. Gather a sample using a microhematocrit capillary tube. You can massage the finger to increase blood flow if you're having a tough time getting another drop of blood. Once you've obtained the sample, seal the tube with a clay sealer. How are you doing, Mrs. Burns?
I'm hanging in there. Oh, I can think of a few more pleasant things I could be doing.
Once you've got your sample, apply a clean gauze pad cover over the site. Now, Mrs. Burns, I just want you to apply continuous pressure until the bleeding stops.
How long will that take?
It should only take a minute or so. Once the bleeding stops, you can assess the site and decide if it needs a Band-Aid.